Have you ever been surprised at the pharmacy counter? Maybe you were just picking up your usual medication. Nothing fancy, nothing new. When the pharmacist quietly leans in and says, "That'll be $492 today." You stand there for a second, blinking. Surely they made a mistake. You check your Medicare card, shuffle through your paperwork, and try to explain, but this was $30 just last month. And then the words come out. "I'm sorry, you've entered the donut hole." It sounds almost silly. The donut hole? Like it's a place you visit for coffee and pastries. But there's nothing sweet about it. For millions of older Americans, the Medicare Donut Hole is a real, confusing, and expensive surprise, one that can cause anxiety, disrupt routines, and force people to choose between medication and groceries. So, what is it exactly? The Medicare Donut Hole, officially called the coverage gap, is a phase in your Part D prescription drug plan where you suddenly pay more out of pocket for your medications. You go from paying a modest copay to footing the majority of the bill. And for many, this happens with no warning, no fanfare, just a sudden spike in cost. Now, here's the good news. There are practical, manageable ways to avoid falling into that hole, or at the very least, soften the landing. And today, we're going to talk about 5 of them. Not in the usual way. No fast talking, no charts, no confusing jargon. Just a warm, honest conversation, like sitting at the kitchen table with someone who's been through it. So let's begin with the first simple truth. Most people fall into the donut hole because they don't see it coming. That might sound obvious, but it's a bit like a pothole on a road you've driven 100 times. You're going along, minding your business, and suddenly, thud, your tire hits it, and you feel it all the way up your spine. That's what the donut hole does. It sneaks up. But here's something that helps. Track your drug spending throughout the year. Every Medicare Part D plan has a set limit on how much total drug costs can accumulate before you enter the coverage gap. In 2025, for example, that threshold is about $5,030. That includes what you pay and what your plan pays, not just your out-of-pocket costs. Now, it might feel like a lot, but if you take several brand-name medications or have any specialty drugs, you can reach that threshold surprisingly quickly. Imagine you take 3 meds, a cholesterol drug, a blood pressure med, and a newer arthritis treatment. Each month, your total drug costs might be $400 to $500. That adds up fast. So here's what you can do. Every month, review your plan's explanation of benefits, EOB. It's not the most exciting reading, we get it, but it tells you how close you are to entering the coverage gap. Think of it like a gas gauge on a long drive. You don't want to wait until you're stranded to look at it. Now, what if you're already watching, already aware, but still edging toward the limit? Then it's time for strategy number 2. Use generic alternatives whenever possible. This one can be tricky because we often get used to a certain name on a bottle, and for good reason. We trust what works. But here's the thing. Many generic drugs are just as effective as their brand name counterparts, and they cost dramatically less. We're talking hundreds, sometimes thousands of dollars less over a year. I remember a woman named Marlene, 67, who was prescribed a popular blood thinner. Her monthly copay was $135. After a careful review with her pharmacist and doctor, she switched to a generic version, $12 a month. Same dosage, same result. And you know what? That one decision saved her over $1,400 a year and kept her out of the donut hole. The best part? You don't have to figure this out alone. Your pharmacist can often recommend alternatives, and your doctor can approve the switch. It just takes a simple question. Is there a generic version of this? It's amazing how often that one question opens the door to real savings. So let's recap, gently. If you want to avoid the donut hole, you start by paying attention. Track your total drug costs, ask about generics, and remember, this isn't just about money, it's about peace of mind. We all want to walk into the pharmacy knowing what to expect, not holding our breath. But what if you're already being careful and it still feels like you're on the edge? Well, that brings us to something a little more powerful and less known. Let's talk about pharmacy choice and why it might be costing you more than you think.
You see, where you fill your prescriptions matters more than most people realize. We're used to thinking of pharmacies like gas stations, more or less the same, right? But unlike gas stations, where prices are posted in neon on the street corner, prescription prices can vary wildly between pharmacies. And those price differences, they can be the very thing that nudges you into the donut hole sooner than expected. Let me share a quick story. A man named Carl, 72, lives just outside Tampa, had been filling all his prescriptions at the same big box store for years. It was convenient, familiar, right down the road. But one afternoon, while waiting in line, he overheard someone at the next window say, "That same drug was $60 less at the grocery store pharmacy." Curious, Carl checked it out. Sure enough, the exact same prescription was $58 cheaper at the grocery store, with the same Medicare Part D plan. No coupon, no special membership, just a different pharmacy. That savings, $58, may not seem life-changing, but over a year, multiply that across several medications, and now you're talking hundreds, sometimes even thousands in reduced costs. And more importantly, less total drug spending, which means you stay out of that coverage gap longer. Why does this happen? Because your Medicare plan negotiates different prices with different pharmacy chains. Some are preferred pharmacies, others aren't. So even though you might be loyal to your corner pharmacy, your plan might not be. That's why it pays, literally, to use your plan's preferred pharmacy network. Here's how you can find out. Check your plan's official website or call their customer service. Ask them directly, which pharmacies are considered preferred for my plan? Or use the Medicare Plan Finder tool online, which can compare prices based on location and drug type. And here's a little insider tip. Sometimes mail-order pharmacies are even cheaper, and they can deliver a 90-day supply right to your door. That's 3 months of medication with less hassle and often a lower cost per dose. Now, I know some folks don't feel comfortable switching pharmacies. It feels personal. Maybe you've been seeing the same pharmacist for 10 years, and they know your name, your birthday, maybe even your grandkids' names. That connection is real, and it matters. But when the cost of staying loyal is falling into the donut hole 3 months earlier every year, it might be time to weigh the emotional comfort against the financial strain. Because here's the hard truth. Once you enter that coverage gap, every dollar counts. But let's pause here for a moment. Just breathe. This isn't about panic. It's about preparation. About choosing ahead of time when you still have control. Because the next strategy is something few people take advantage of. It's called medication therapy management. Sounds like a fancy term, but it's actually a free benefit included in many Part D plans. If you qualify, and most people with multiple chronic conditions do, you can get a personal consultation with a pharmacist or clinician. They sit down with you, go through all your medications, and look for ways to streamline, simplify, and save. Sometimes they find duplications, medications that are doing the same thing. Sometimes they spot interactions or outdated prescriptions. And very often they find lower-cost therapeutic alternatives. I remember a woman named Edna. She had 7 medications and was terrified of falling into the donut hole again like she had the year before. She signed up for the medication therapy management program through her plan. After a 45-minute session, they discovered that 2 of her meds were overlapping in function. With her doctor's blessing, they adjusted the dosage, removed 1 prescription, and found generic alternatives for 2 others. She ended up saving over $800 that year, and more importantly, her health actually improved. Fewer side effects, fewer pills to juggle, and that peaceful feeling of being on top of her care, not at the mercy of it. That's the heart of this conversation, isn't it? Not just avoiding a financial trap, but regaining a sense of power. Too often, Medicare can feel like a maze. Endless forms, confusing terms, and no clear map. But when you stop and ask the right questions, is this pharmacy the best for me? Is there a way to simplify my medications? You stop reacting and start guiding your care. And maybe that's the quiet power we all need more of as we age. To feel informed, equipped, and capable of making smart choices, not just accepting what's handed to us. But there's one more piece we haven't touched yet. What if there was a program right under your nose that could help you avoid the donut hole almost entirely? Something legal, safe, and designed exactly for people like you. Let's talk about it.
A few years ago, I met a gentleman named Harold. Harold was 69, retired from a job in maintenance, lived alone in a small 2-bedroom home in Indiana. His wife, Linda, had passed a few years earlier. His kids were scattered, one in Colorado, one in Ohio, and though they called, he didn't want to burden them with money stuff. Harold had diabetes. He took insulin, blood pressure medication, and a heart drug. Nothing exotic, just the usual mix so many people his age take to keep things stable. For most of the year, everything was fine. His Medicare Part D plan worked. The copays were predictable. He could plan his grocery trips and his prescriptions all on the same budget line. But in September of that year, something changed. He went to pick up his insulin, and the pharmacist gave him the number, $472. He thought it was a mistake. He even laughed a little and said, no, it's usually $45. But it wasn't a mistake. He had entered the donut hole, and no one had warned him. Not his plan, not the pharmacist, not the paperwork, which he never really read. One day, it was $45. The next, it was more than 10 times that amount. Harold paid for it that first time because what choice did he have? But the next month, when the same bill came up again, he made a different choice. He started skipping doses, cutting pills, taking insulin every other day, stretching medications like old leftovers. By November, he was dizzy all the time. By December, he fell trying to stand up too fast in the kitchen. And by January,
He was in the ER with dangerously low blood sugar and irregular heart rhythm. Now, here's the part that hurts. Harold didn't need to go through that because there was a program that could have helped him if only he'd known about it. It's called Extra Help, and it's one of Medicare's best kept secrets. Extra Help is a federal program that helps people with limited income and resources pay for their prescription drugs. It reduces premiums, lowers deductibles, and dramatically cuts the cost of medications, even in the donut hole. And the most heartbreaking part, millions of eligible seniors don't even know they qualify. In fact, an estimated 2 to 3 million Americans who are already eligible for extra help haven't applied. That's 2 to 3 million Harolds, quietly struggling to afford meds, cutting pills in half, skipping days, while the safety net that they need is waiting. Eligibility varies, but it's more accessible than most people think. If your income is around $24,000 a year or less for an individual, or about $36,000 for a couple, and your assets are within certain limits, things like savings and investments, not counting your home or car, you may qualify. Some people qualify automatically if they also receive Medicaid, supplemental Social Security, or certain other benefits. But even if you don't get those, you can apply on your own through the Social Security Administration. The benefits? Low or no monthly premiums, no annual deductible, lower copays for prescriptions, protection from the donut hole. For Harold, it would have meant paying $3 or $8 per medication instead of hundreds. And he never would have had to choose between health and food, between stability and fear. That's why I share his story, not to scare you, but to remind you, there are options. There is help. Sometimes it's hidden in fine print. Sometimes it's buried behind phone trees and government websites, but it's there. You just have to know to look or to ask someone who knows. So, if you're unsure whether you qualify, you can call your state health insurance assistance program. They offer free, unbiased help. Visit ssa.gov/extrahelp, or just ask your pharmacist or doctor. They often know or can point you to someone who does. Because here's the truth. You've paid into the system your whole working life. You've earned the right to understand it. You've earned the right to be cared for, not just medically, but financially. Now, let's imagine you've done everything right. You're tracking costs, using generics, filling prescriptions at preferred pharmacies. Maybe you even qualify for extra help. But what if you still want more control? Not just avoiding the donut hole, but truly managing your medication costs like a pro. There's one more step, and it's something most people don't do, but should. Let's talk about annual plan reviews and why choosing the right Medicare plan might be the biggest money saver of all.
Every fall, like clockwork, the mail starts arriving. Thick envelopes, tiny print, some from Medicare, some from private insurers, all filled with terms like annual notice of change or formulary update. And if you're like most folks, you look at that pile of paper, give it a long sigh, and set it aside. Maybe you tell yourself you'll get to it later. Maybe you figure your plan worked okay this year. Why mess with it? You wouldn't be alone. only about 30% of Medicare beneficiaries actually compared their plans during open enrollment. But here's what most people don't realize. Not reviewing your plan each year could be the very reason you fall into the donut hole. Let me explain. Each year, Medicare Part D plans can change. The drugs they cover, the pharmacies they prefer, the co-pays and premiums they charge, even the coverage tiers of medications. So the plan that worked great for you this year, next year, it could be covering your heart medication at Tier 1 instead of Tier 3, saving you a bundle. Or it could drop it entirely. And unless you check, you won't know until it's too late. There's a man named Daryl, 75, widower, Navy vet, who had been with the same plan for 7 years. It was habit, routine, familiar. But one fall, his granddaughter, a sharp, curious 24-year-old nursing student, visited and offered to help him go through his mail. Together, they used the Medicare Plan Finder tool online and plugged in his current prescriptions. To Daryl's surprise, another plan, same insurer, different structure, would have saved him $800 a year. It had lower drug costs, better pharmacy options, and more generous coverage in the gap. He switched that year and never looked back. And you know what he said? It wasn't about the money. It was about knowing, about not feeling lost anymore. That's what the step is really about. Clarity, confidence, control. Reviewing your plan doesn't have to be scary. You don't need to do it alone. In fact, here's how to make it easier. Mark your calendar. Medicare open enrollment runs from October 15th to December 7th each year. Set a reminder in September to start looking. Use the Medicare.gov Plan Finder tool. It's designed to compare plans based on your zip code, pharmacy preferences, and exact list of medications. Talk to a SHIP counselor. The State Health Insurance Assistance Program offers free one-on-one guidance. No sales pitches, just help. Ask a trusted family member. Sometimes it's easier to do this with a son, daughter, grandchild nearby. It's a chance to connect and to make sure you're not missing anything important. I know all this can feel like a lot. Like Medicare has become this endless puzzle with moving pieces and hidden rules. But here's something most people don't hear enough of. You are allowed to change your mind. You are allowed to switch plans. You are allowed to ask questions. You are allowed to do what's best for you. You don't owe loyalty to an insurance plan. You owe loyalty to your health, your peace of mind, your ability to live each day without that knot of financial worry in your chest. And the beautiful part, that change, that power, is just a few clicks, a few conversations away. Imagine starting January knowing your plan is working for you, not against you. That your prescriptions are covered, your pharmacy is preferred, your drug costs are manageable, and that donut hole is miles away. Feels lighter already, doesn't it? Now, before we close, I want to share one final reflection, because avoiding the donut hole isn't just about money or medicine. It's about dignity. Let's talk about that next.
There's something nobody really says out loud, but most of us feel it. Getting older means making peace with 1,000 little changes. Your body changes, your income changes. Sometimes your circle of friends grows smaller. And through it all, you're expected to keep navigating systems, like Medicare, that feel more complicated every year. But here's the quiet truth behind everything we've talked about today. This isn't just about avoiding a gap in drug coverage. It's about preserving your independence, about making sure you never have to choose between medicine and meals, about never feeling ashamed at the pharmacy counter, about holding on to your dignity, not because someone gave it to you, but because you've earned it. You've worked hard your entire life. You paid your taxes. You raised your family. You showed up day after day for your community, your job, your responsibilities. Now, this part of life, this chapter, is supposed to come with less worry, not more. So when we talk about watching your drug costs, or switching to generics, or asking about extra help, it's not just advice. It's a form of self-respect. You are not helpless in this system. You are not invisible, and you are not alone. Because every time you ask a question, or make a call, or say, actually, I'd like to double check that, you are stepping into your power. And that ripple, it spreads. When you share what you've learned with your sister, your neighbor, the folks in your bridge group, you become part of something bigger, a community of older adults refusing to be taken advantage of. You become the wise voice someone else needs, just like you've needed a few wise voices along the way. So if you take one thing from this entire conversation, let it be this: you are not stuck. There are steps you can take today to protect yourself. Let's revisit them softly, without pressure. Keep an eye on your total drug costs throughout the year, not just your copays. Ask about generic alternatives. They can make a massive difference. Choose a preferred pharmacy or explore mail order options to save more. Look into medication therapy management, a free resource that could uncover savings hiding in plain sight. And if you're on a tight income, apply for extra help. It's there for you. Lastly, don't let the annual enrollment period pass you by. Review your plan every fall. It might be the single most powerful move you can make. Now, before we close, I want to ask you something simple. Was any of this helpful to you? Did something we talked about today make you feel a little more prepared, a little more in control? If so, I'd be honored if you'd consider subscribing to this channel. Leave a comment, even just one word, and let me know you're out there. Share this video with someone you love, someone who might be sitting quietly, feeling overwhelmed by it all. Because none of us should have to face this stuff alone. And if you have questions, leave them below. This isn't a lecture, it's a conversation. One that continues, one we build together. You've got wisdom, you've got experience, and now you've got tools. So take a deep breath. You're not falling into the donut hole. You're stepping around it with eyes wide open. And that's something to be proud of. Until next time, take care of yourself. Stay strong, stay curious, stay empowered. We'll talk again soon.